Okay, so for the first assessment, we're going to do a double overhead squat. So double overhead squat will look at the closed kinetic chain of the lower extremity. It will look at lower abdominal, pelvic control, as well as rotational control. That can be evidenced by the knees, but obviously is mainly affected by the hips and the feet. So what you want to do first is you want to stand with your feet just about hip width apart. Feet should be pointed straight forward for this test. The problem, if you do it with their feet externally rotated, you're actually increasing the base of support. So they're creating an environment that is natural to them to be able to provide some anti-rotational control, but also be more stable for them. So if they put them in a standard forward-facing position, you can look at their neutral alignment, making sure that their knees are pointing in the frontward direction. So what you want to do first is you get them to put their hands above their head like they're carrying a tray of drinks to the dock for their friends, and you don't want them to be to spill them. And then what you want to do is get them to sit down on an imaginary chair behind them. And what you're trying to do first is you're looking at pelvic posture, make sure it's in a neutral position, doesn't tip into an anterior tilt, and then sit down from there. You should feel the abdominal muscles engaged, the core muscles around the pelvis to engage, making sure the knees are staying aligned and not moving in like the dynamic internal rotation, making sure that the feet aren't pronating or collapsing towards the inside, and then you come on back up, okay? Some people can't go down any further, and so what they do is they stop, they go down a little bit, they stop there, and then they try to make it look like they're actually squatting further by leaning forward, but all the drinks are falling off the tray, so that's no good. So then another abnormality you'll see is if they go down and they will start to have dynamic internal rotation of their knees. They'll start squinting, and that's indication of lower core, pelvic weakness, but a lot of external rotational control at the hip level. You also, the secondary rotational control factors at the feet, the intrinsic muscles of the feet that form the medial longitudinal arch aren't strong enough to keep the knees rotated out. Okay, so this is your primary line of defense, and then this is your secondary line of defense. Okay, that is number one. Number two. Okay, so this is number two. So number two is where we're going to do single leg stance. So we get people, it's actually better to have them with their socks off. It's been shown that any interface between the sensory surface of the plantar aspect of the foot and the floor alters the body's ability to maintain balance. So when you take your socks off there, it also allows you to have a good look at their feet and look at engagement of the muscles in the feet when they're doing these exercises. So hands on your hips. And I'm going to get you to stand on, just so that I have a little bit more room, stand on your right leg. And so what you're looking at here is you're looking to make sure that, to see what kind of rotational control they have. Seeing if their pelvis remains level, looking at their shoulder height, making sure it remains level, seeing if their balance is good. And people say, oh, I got the worst balance. Well, it's not because of centrally mediated balance coordination through the isthmus system or the labyrinth system, but you're looking at the motor control at the feet, because the feet are doing the fine control of rotation. You can just see it sort of twitching like it is in the lead-out. So this is in a fairly stable position, but if you put a little bit of slight knee flexion into it, you're all of a sudden taking them into a more compromised position, where you'll see if these rotational control properties are more robust. So making sure pelvis is stable, making sure that alignment is good, because their center of gravity is here, coming down through the inside of their foot. So the natural tendency is for this to dip. And the glute med and tensor fascial lather are trying to keep it upwards. So then you go back up into a straight leg position, give you a break for a second.
Thanks.
Okay? And then you put it into a dynamic process. Okay, so you stand on the one leg, and then you go down into a squat, and you're looking for maintenance of pelvic level, shoulder level, seeing if there's any rotation of the contralateral leg behind them. Okay, and stand up. So an abnormality would show, okay, so go up and do your internal rotation. So it would be that you'd have pelvic drop, you could have internal rotation of the knee. You could also have this leg coming behind the other leg in order to centralize the center of gravity over the limb. So when you're in this position, what I often will do is if you see something, like say you see that hip drop, okay, go down. I'm going to cue you by having my hand here, keep that hip up. But actually it'll pull out another abnormality. You'll have internal rotation of that knee, or they'll rotate their body. So something else will come out if you correct one thing. So coaching has been shown to actually allow you to isolate and bring out other abnormalities. Okay, so this is the modified Thomas test, and so what I get people to do is you go put their bum right on the edge of the bed, they lean back and they bring their knees towards their chest. So lie down. Okay, and you always put the disclaimer of I'm here to hold their legs and ensure that we can look at the resting tone of the muscles in their lower extremity. Okay, so what I get, okay, let your hands go and just put them on your chest, okay? We haven't practiced this one. Okay, so we're gonna get you just to lower your right leg, and you gotta make sure they're in shorts or they're in like flexible pair of pants, because obviously pants can pull and can give you a false positive. So when I'm looking here, I'm looking at the three-dimensional alignment. I'm looking at internal rotation and external rotation at the hip, as indicated by alignment here. I'm looking at abduction and adduction, which will indicate hypertonicity of one muscle group versus the other. It's all about that yin and yang. You've got one muscle group working with the other muscle group. If you have, so hip flexion is one thing. So if you have somebody who has a normal, relatively 90-degree angle at the knee, but they're held up into this hip flexion position, it's more iliopsoas than it is if it was rectus femoris. Okay? And so if somebody's got tight quads, you're going to see this leg stretch out like this. And you can give them a little bit of relaxation, just to say, okay, relax this leg, just let your leg drop, okay? So also looking to see if when they're doing this, if there's increased lordosis to their spine, because that might be a false positive that's getting them down to this area. Then you get them to bring it up. Same thing, reset your lower back on the bed, and see just let them relax, okay? And bring this leg down. And so you are comparing one side to the other. Again, looking at the comparison of midline to see if there's abduction or adduction, internal rotation versus external rotation, and see if there's knee extension indicating quad tightness or hip flexor. And that's the modified Thomas test. So I'd like to thank Alita Carlin, our athletic therapist here at Reactivate, for her time, but also hopefully this was useful to you. If you have any questions, please don't hesitate to send an email to me to ask me questions or comment in the video below. And if you want more information to see what we're all about, visit reactivatemuskoka.com.